Time is y'all don't have to come up here. You can stay where you are. We've got these cameras that are going to find you where you're at. So does either group want to go first? Do you all want to go first, Mr. Anderson? You ready to roll? Okay, and again, in telling your story, sharing your story about a solution-minded approach, don't feel like you have to read every single word on your sheet. Give us the essential story.
Things we could do collectively, our allies around the table, from Celebrate One to local matters and other agencies. But what we really focused on was what we can start doing new, different, or better. And we talked about increasing the number of connectors. Those are community health connectors that look like and represent the communities they serve. We talked about creating the Columbus Mobile Market to take fresh foods into underrepresented food areas, those food deserts that we find in the city. We also talked about a new investment, an investment in a pathway to creating opportunities for black men specifically to enter, retain, and graduate in healthcare careers, majors, and programs. We also discussed providing cultural competence training for our healthcare providers and being intentional on our parent engagement. Another big one is bringing fresh cooked foods into our school lunch program. We discussed big about the fact that you can go in any of our schools during the lunchtime and they are opening up the packages and put them in the oven and passing them on to our young people, as opposed to the good old days where the food was cooked right there. You stood in the line and you have a little scoop of those, and they put a big scoop. We also talked about creating family access points in healthcare, where not only the parent gets treated, but the child gets treated all at the same time. So we go to the doctor, as opposed to I have a doctor's appointment, you have a doctor's appointment, we have an appointment. We can do that, and then also educating more on mental health issues to help remove the stigma in our community.
Thank you. And we will move over here. Who is our storyteller? Lolita?
I don't know how I keep getting picked to do this. Let's see. We had a very interesting conversation. It was passionate. Yes, it was spirited, and we had some real good stuff come out of it. So let me see if I can figure it out. So we talked a lot about when it comes to health in regards to our men of color. There's trust. They stuck with trust. Javier talked about earlier. A lot of our men don't, or our students, our kids, our black males don't want to go to the doctor because they don't trust what they're saying. It's just a stigma in our community. Our families don't even recognize. They ignore mental health. I have no idea. They ignore mental health. Help me, because you wrote it. So they ignore. Okay, he's our solutions. Okay, I'm sorry, I didn't write this, and this is her mind. So they ignore mental health issues. They ignore the fact that sometimes nutrition has created some of those mental health issues. One of our other issues with our health is violence. That's a big thing. That's what we talked about with that. So someone wanted to make sure that we have focused organizations, like one of our new programs, Care Alliance, is that what it's going to be called? The CARE Coalition is going to be focusing on mental health and removing that stigma. They're going to be focusing on trauma and trying to come up with programs that help in employment, help our men gain employment, or teach them, show them men that look just like them doing something different in our community, or doing something different in a career besides what they've seen at their homes. Let me see. Some of our solutions are make sure that we have some of our restored citizens at the table. What is this? Make sure that we get some of us and some of our black males involved in different committees and different groups that's in our organizations that are in some of our allied companies. Let's see. I'm so sorry. Let's see. Try to make some policies that bring more funding to the table to expand on different programs like the CARE Coalition. Let's see, down here, what was something else we talked about? I said employment, didn't I? This is hard to go by. Let's see. We talked about men just don't go to the hospital, or some of our students aren't going to the hospital. So maybe when the parents go to the parent-teacher conferences, they have things like food demonstrations to show them how to cook different things, or maybe even health assessments right at the parent-teacher conference while they're waiting for everybody in the home. We talked about lack of representation from our healthcare professionals. So they, just like we don't have trust to even get to the doctor when they get there, maybe there's no doctors or no nurses or care practitioners that look like them. So we need to make sure that they have that type of information. We talked about making sure that to get the information out, we go into the community and knock on doors sometimes, because sometimes maybe they don't speak our language, or maybe they don't know the different programs that are in our community that they can access. If they receive Medicaid, maybe they think that they only can go to a clinic when they can get special references or go to see a specialist for whatever their mental health issues are. And we talked about just not having that education, not knowing that nutrition can be a cause for ADHD. It can heighten those symptoms in the classroom. We talked about, I can be here all day. Lack of transportation. So sometimes kids may not get there because they don't have transportation from their neighborhoods to get to a health program or a health care physician. So those are some of the things that we talked about, but we wanted to expand on those items and expand on finding the things in our community that's working and expand on those. Some things that were mentioned was like the Father program. It is working. The African American Walk, that is working. They have data that's showing that men are surviving by just going to that walk. So can we help make sure that those programs get funded and expanded on so that we can save some of our kids' lives? Thank you.
Thank you. One of the things that I'm encouraged about in terms of what I heard from both groups is addressing the issue of mental health. What I like to say is all boats on the health lake rise when you address that issue. You address the mental health issue, you're going to see an impact on obesity and high blood pressure and risky sexual behavior and violence and all the negative coping methods that we use to deal with this trauma and the stress that we experience when we live in vulnerable communities. The other thing that I'm encouraged about by this process and the experience that you all have gone through, and the reason why I'm willing to invest my time, effort, and energy in being a part of this process, which I'm very selfish with my time and efforts and energies, but the reason why this is okay with me is because I know we're not just going through the motions. We've all sat through these meetings and had these kind of discussions, formally or informally, and what is different about this opportunity is that it's not about today. It's about what happens tomorrow and the next day and the next day after that. And the Department of Neighborhoods and Councilman Hardin are committing to efforts beyond today, and not just in word, but in deed. So I'm going to let Councilman Hardin share what happens next or what happens now as a result of you all creating these stories.
And thank you all for staying this evening and really being engaged. Again, this is the fourth conversation that we've had like this, where we were able to hear the data, understand where we are as a community, and then create a story about how we work as a community collaboratively to provide access and opportunity for our young men of color. And like Javi said, Mr. Sanchez said, this is not a one-time program, one-time initiative. This is our community's commitment to this demographic, our young men. And so with that, we are going to take the information that we got from the 4 sessions, and we are going to, within the next couple weeks, roll out the full report. And the full report will be a resource for every one of you to use. The data will be there. It will be interactive. And you will be able to see the asset maps where other organizations are throughout the community. And so, one, you'll have the resource of the report that will roll out. But secondly, we're going to put dollars behind what we're talking about. We're going to roll out an MBK grants program. Using the information that you provided tonight and the other 3 conversations to drive our community's engagement from the city perspective for young men of color. One of the things that I've heard each one of these sessions was, how do we break down silos? The issues that we're talking about, so many folks are working on them, and we at once need to celebrate the individual work of the organizations that are out there doing these things, and that's something that I have to say, we all need to stay conscious of. Folks have been working to support our young men of color for many years, and have been doing great work, and so we need to lift them up and celebrate the work that they're doing. We need to find those who are out there doing the work but just need capacity building and support, need to link up with another organization. And so we hope with our dollars that we'll put out into the community that we will be able to encourage the collaboration, use the data as the baseline, we'll start from, create metrics in which we'll gauge our success and our engagement, but really move forward together as a community. I've heard it said, there have been the question over the last couple of years of what is MBK, or who is the real MBK? You know, a group has an MBK over here, another group has an MBK over there. And I realized that even us, me, the city, we were falling into those silos. Well, we're this MBK. The real question or the real challenge would be, what is your MBK? So regardless of whatever organization you are, what church you represent, or if you're just an individual, what are you doing to support young men of color? And how can we work together in our combined collective efforts? And so this is where we are going. So I really do appreciate your time. There really will be a next step. But I will even say this, the grants program is not it. That's just what we're doing right now. It is a piece and partial. When I say it's a commitment to our young men, this is not a one-off commitment. We will continue to work collaboratively. We will continue to engage each and every one of you in this space, and we will continue to move our community forward. We did not get here with our vulnerabilities overnight, and we should not expect to solve everything overnight. So we're in this for the long run. And that's what we want folks to know, especially the young men, that we are in this for the long run. And so I appreciate the work that each and every one of you do on a daily basis to impact the health of our community. Certainly want to thank Kerwin for the 6 months, it seems even longer than that, the deep dive that we've been working on this. Certainly to Javier Sanchez, he has helped us articulate the things that we have as a community, our assets, and a vision forward, and so I'm extremely grateful. Certainly want to thank the Public Health Department for being a host for this conversation. Want to recognize again Celebrate One for the work that they're doing out in the community and for being here and adding to our conversation tonight. Want to thank the Department of Neighborhoods. This is housed in the Department of Neighborhoods. That's the tie that will keep us going. That's where this program lives, and I've been very appreciative of the entire Department of Neighborhoods team in this work. And then certainly to my staff, Linda and Zach, who are wholly committed. Have a great evening, everyone.